And so we'll go ahead and get rolling. Thank you all for joining this morning. I think, as I've said for a number of years, this is one of my favorite presentations of each year, mainly because I get to brag about all the things that all of you are doing. And I do that unashamedly because of the phenomenal things that you are accomplishing as a center, and we as the Mailman Center are able to do, not only in terms of accomplishments, but impact for our families and the communities that we serve. This is our 2021 update. I'm going to apologize in advance. The IPC leaders and others sent me volumes of material. And when I realized what I had, I realized that there was no way I was going to get everything into an hour presentation. So if your particular program is left out today, it's not because it wasn't important. It was because we ran out of time. But we have many, many different components. I want to start by saying a thank you to Jeff and Michelle and Ottawa, who really provide tremendous leadership support to us at the center, to Alan Delamater and Jason Gent as two of our cross IPC leaders in the areas of research and innovation, and all of the leaders of our IPCs, our major program leaders, and all the members of the steering committee. If it wasn't for the extent of our leadership at the Mailman, we would not be accomplishing any of the things that we're doing. So you know our vision, improving lives through innovation, impact, and connection. And I think as I share with you where we are today, those words and that vision will, I think, be affirmed. It's a vision that has held up in the 6 years since we came up with it. It continues to be highly relevant and very, very helpful. And I think you'll see that as we move forward through the day. For those of you who are trainees, new staff, just a quick overview of the history of the Mailman Center. We were one of the 11 original university affiliated facilities funded in 1967 by the federal government, a grant program by the Abraham and Joseph Mailman Foundation and by the John F. Kennedy, or the Joseph F. Kennedy Foundation. We opened in 1971 as the third academic center at the University of Miami. The Debbie Institute was founded to create innovative approaches to childcare and development. And we were designated as a University Center of Excellence in Developmental Disabilities and Public Law 10642, the Developmental Disabilities Assistance and Bill of Rights Act of 2000. It is important as we think about our vision statement and the things that we'll talk about today to go back to a quote from Abraham Mailman that appeared in the Miami Herald on March 22nd in 1971, when our building officially was dedicated. Mr. Mailman said, "What about the 6 million children in America who already need centers such as this? Already in this center, children who have grown up hanging their heads are learning now to look up." And that was a perspective from 50 years ago. And I think where we are with our vision, we are really focused on those other 6 million plus kids. And that's really why we are existing every day as a center. The original purpose of the center was to provide multidisciplinary training that would address workforce needs of individuals with what was called at that time mental retardation. This was really led by Eunice Kennedy Shriver, who was a huge advocate with President Kennedy, and it resulted in the funding of the university's affiliated facilities to create training so that individuals with developmental disabilities could move out of institutions and into community settings. That was the original reason we were built and put together. We've passed our 50th anniversary. We were going to have a celebration last year. We are gearing up to try to do that again this fall, barring no more surges, although it looks like we may be in one right now. So we're going to call it the 50 years plus one for COVID. And you'll hear more about that. Dr. Howell, Rodney Howell, is going to be the chair of the planning committee for our celebration. I'm not going to dwell a lot on our organization chart. We've played with it a lot. It came out of our strategic planning process in 2014. And it was innovative at the time. And I will tell you from looking at other USEDS and LEND and IDDRC programs across the country, it still is quite innovative. We did break away from silos and move to a strong functional approach using interprofessional collaboration and the development of our IPCs with a focus across all the IPCs in research, training, clinical care, and community engagement, and strong input from an advisory committee, our Mailman Advisory Council, or the MAC. And in the process, we really rely heavily on our large specialized program, the Debbie Institutes, our Early Steps program, the Child Protection Team, the school health programs and the mobile clinic, and our accredited disciplinary programs. When we did this, we didn't know what was going to happen, but I would like to share with you for the next few minutes how impactful that change was for us as a center. Now, I learned a long time ago that if you're going to be a mystery writer, the whodunit comes on the last page. But if you're going to be a scientific writer or you're going to focus on programs, you want the answers to be up front and then describe what they were all about. And I want to take a second to just really very quickly bullet points some of the notable accomplishments of the center this year. Very excitingly, our progression across transitions in healthcare, the PATH Clinic, our program to help older adolescents and young adults move into a primary care medical setting, an initiative between our Lifespan IPC and the Department of Medicine, the Medical Peds program has now opened. We have our first patients coming through, and this is a way for individuals with autism, Down syndrome, cerebral palsy, and others to be able to get primary care in a highly competent setting. This is a major initiative and novel, innovative program that we've been able to pull out in 2 years. We were able to take the DASH program and turn it into a rapid response training for hospital healthcare providers. That's been freely distributed and made accessible across the country. And there are many folks that have used this. This really applied to issues of taking care of older adolescents, young adults, adults with developmental disabilities in ICUs related to COVID. A very appreciative and high impact initiative. We've gotten grants from the Agency for Community Living and the CDC as part of our work with AUCD to work on vaccine confidence. And we have made that decision to work very closely with our community partners in Overtown and East Little Havana and the Northeast Corridor. And that work is going along very, very well. We recognized at the time these grants came out that they were primarily focused on adults for vaccine hesitancy, but we now have vaccine availability for 5 and up. And we anticipate in the spring vaccine availability for the birth to 5. And so being able to focus on the vaccine issues in the younger children is going to be a really very important part of our future. Jeff Brosco managed to get another perfect score on our LEND application for our 5-year renewal. That was not at all a surprise. Our LEND program has been at the top score for now 20 years. And very, very excited about that affirmation of the work that we're doing. Jason Gent led our initiative with the Children's Trust to work on a triaging to sew together programs. We'll talk about this a little bit more. Project SEW has been funded and is off and running. Dr. Natali and the group have really worked on developing a network of child care centers that serve children with special needs across the county, and a tremendous impact in the early childhood area. We've gotten new federal research grants awarded, an R40 and R01, a large Department of Education. And as you may remember from prior State of the Mailman, one of our goals was to begin to shift to, not to shift, but to expand our funding from research grants at the federal level. And these are really great hits. And Dr. Natali is PI of 2 of those, which is an incredible accomplishment. We have implemented the Pediatric Behavioral Health Collaborative with the Department of Psychiatry and Behavioral Sciences. Dr. Delamater is working closely with Dr. Coffey on really looking at ways to enhance behavioral health services in pediatric practices and with other groups across the state. Dr. Nellie Garcia received the Micah Batchelor Fellow Award, and we're very, very excited for Nellie in that role. This is the first piece is the one that's at the top, and you're going to see another picture of the cartoon videos on mask wearing, social distancing, and child care school reopenings. That was an early initiative in COVID that Dr. Natali and the Jumpstart team led for us. And I actually heard the other day from one of the other hospitals here in Florida that they are still using that in some of their clinic settings. So long outcome. We've been involved with the collaboration on statewide infant mental health system of care with Power Up for Babies, another systemic impact. We are expanding our community partners. We've had 5 years of great partnership with Overtown and East Little Havana, with the Overtown Children and Youth Coalition, and with Connect Familias. And we've made the decision to reach out, and we'll be working closely in the Northeast corridor of Miami-Dade with the St. Law on initiatives like we've done in Overtown and East Little Havana, but focused on the needs of the Northeast corridor community. Our Access Miami website launched. Shelley Bear was a driving force behind getting that done. We've added disability content to the Next Gen ND curriculum. This is actually a leading initiative across medical schools in the country, and one that is very welcome by the folks in the Department of Education. We have had some really interesting publications. Dan Messenger and his colleagues did the used geotracking type technology to determine infection transmission risk in the Debbie School classrooms. They were able to do a study with results suggesting that mask wearing was not associated with communication delays in young children. So there was a lot of concern that this would really impair development, having to wear masks, but I think what we found is the kids are very resilient. The cultural formation interview, Dr. Sanchez, Dr. Janet, and others just had a paper published this week showing that type of interview really improved engagement of Spanish-speaking families in service delivery. And we are working very hard across multiple sites to create integrated data systems, dashboards that we can use for real-time program evaluation and planning, as well as reporting of the activities that we're doing at the center. And Casey Sowers is our expert working closely with Jason Gent on that initiative. So a lot of accomplishments. I want to start by acknowledging the members of our Mailman Advisory Council, the MAC. This is a dedicated group that meets 3 or 4 times a year. They have contributed a project idea to each of our major USAID grants for the last number of years, and are our feet on the ground in the community. And they are our perspective setters as we come up with new ideas. I just say thank you to everyone there. I used to, on the different IPC slides, list all of our collaborators, and I decided that those, I have to use like 0.5 font to be able to get them all. So I just want to acknowledge, and I've probably missed a few, of the various agencies, organizations in South Florida, in Florida, across the US, and in some cases international collaborators where we've developed affiliation and we're working with folks. It's an impressive list. And I know I've left some people off, but we've added some new folks. Paula Perez and Luisa Mali joined us this fall. Doug Lean, who has been with us for a very long time, she needs no introduction, but she's joined us as faculty now. Lydia Ocasio-Stoutenberg is in the process of joining us as faculty in pediatrics. And we've added Nastasia Boulos and Casey Sowers to our core administrative team, working on our website, our annual reports, and our data systems. Austin Gorilli has joined the AT program and is really helping us with that. And I added very quickly Joanne Valenzuela, who was part of our Mailman family for a very long time and has come back. And we're happy to have Joanne as part of the group. And if I've forgotten anyone on this list, it was not intentional. It was wading through too many pieces of paper and I missed something. One of the things that we think about when people talk about the Mailman Center is, if I ask folks, they'll say, well, isn't that concrete building on the corner by the Metro Rail? And then others will say, well, isn't that part of the Department of Pediatrics? And then others will say, isn't it a university center? And the answer to that is yes. It is a large building. The Mailman Center and the Debbie School were constructed with those federal dollars and the philanthropic dollars that I mentioned a little while ago. And we are the largest division of the Department of Pediatrics for the folks who have their faculty appointments in the division, or in the Mailman Center division. But we are also a matrix center of the university, and that was established many years ago. And in that respect, we work to promote efforts in research and training, clinical care, community engagement, advocacy around developmental disabilities across the entire university. This cartoon slide in each of those boxes shows you all of the other departments, schools, colleges, institutes, and centers of the university where we have active collaboration going on at this point. And so in that respect, we really are a center of the University of Miami, which is a great honor for us to have and a great accomplishment. This slide I really enjoy playing with because you can talk about all the programs and the impact that we wind up having as a center. But at the end of the day, people want to know, how much money did you make? Did you lose your shirt when you changed your infrastructure and your organizational chart? And this slide will show you very clearly that we did not. So in the last 5 years, we've gone from leverage funding from all of the investigators that are members of the Mailman Center, all our grants and contracts, that was at about $25 million. And this year we reported out $32,600,000. And so what we've seen is about a $7 million increase per year in funding for the Mailman Center. And that really is kind of a spectacular accomplishment. I'm actually very pleased that if you look at the sources of funding, the one we really wanted to impact, not impacting it quite as fast yet, but I think we're right on the edge, is the federal funding. And you've seen that it has gone up steadily each of the last couple of years. Similarly, our state funding has gone up. Local funding, we're relying less on that as we're replacing it. And we've had some other foundation, actually a good deal of foundation support that has come in for our various programs. So there are very few programs in the University of Miami, besides perhaps the Sylvester Cancer Center, that are growing as rapidly and with as much sustained growth as we've been able to have. So why do we start with the money? Well, it's the money is what makes it possible for us to do what we do. If we don't have the money, we've got some real limitations, but this is a really good sign of what we've done with almost $140 million of funding coming into the center over the last 4 years. When we look at the original intent of the Mailman Center was to train, and that's where we started. This is a breakdown. This year we trained, I think my numbers are there, 87 long-term and intermediate term trainees. Again, as we've looked at in the past, about 75% of our trainees are of minority background. And for our Hispanic trainees, we train fully 25% of the Hispanic trainees that are trained in the United States at all of the LEND programs. That's a phenomenal impact. And that's a real commitment to us, is to make sure that that cultural diversity, the inclusion, and ultimately equity that we are able to impact through our work comes from our commitment to this incredible group of trainees. And when we do a good job, then they will go elsewhere and they will do a good job elsewhere, and we will be spreading the word. There have been some significant training accomplishments across IPCs. I wanted to highlight those. We've talked about the disability awareness and sensitivity in healthcare, the DASH training program that the Lifespan IPC developed and then modified for this hospital healthcare worker intervention during COVID-19. Those are very big programs, and we are, as we move forward with refining the DASH program, we've been talking with the group that handles intellectual property about perhaps commercializing our DASH program as a revenue stream coming into the center to help support other projects. A few years ago, we made a decision to go to an online learning community. And I know a number of you did a lot of work on that. We now have 8 courses up. This last year, we had over 2,000 views of our online courses that have gone up. Our YouTube videos have had more than 15,000 views. So we are getting out there into the community and being recognized for the work that we're doing. A lot of our work early in the COVID epidemic and continuing all the way through focused on telehealth and helping developmental behavioral providers be able to utilize telehealth effectively. And that continues to be widely disseminated and used, as well as the Step Up AT teletraining toolkit for teachers that could promote early literacy development in young children. And there are many other accomplishments we have in the training area, but I wanted to highlight a few of these that have really been some of our most innovative. And we have more coming this next year. When we look at what our impact is in terms of training and assisting the community, you'd think that during COVID that would be suppressed. And it was during the initial part of COVID. But this last year, as you can see, we had 10 webinars, 52 different continuing education activities, and 46 different community trainings impacting over 6,000 participants. That's pretty good, folks. I give everybody great credit for the work that we're doing in terms of our outreach. Know that we have our leadership pipeline program with our disciplinary programs in training, our family training, and people with persons with disability and SALT training program, particularly the SALT, the self-advocacy leadership training. We have our SELP program, the Student Exceptional Leadership Training Program, and the ETLP program that we've had for a number of years that feeds into our statewide collaboration around the Next Gen Training Collaborative. And despite COVID, these training programs have continued to function and do incredible things. I just wanted to highlight a couple of them. Our ETLP class, our 9th cohort have developed a project, the UCANE ability, which is focused on improving employment for people with disabilities at the University of Miami in our home area. If we're going to do inclusion and we're going to promote full inclusion and participation, then it really starts at home. And that's what that ETLP class took off on. Our CELP program was implemented virtually at the great consternation of Shelley and Hyro, who said, we just can't do this virtually. We have to be in person with these high school students, but they did it. It has taken some bumps in the road, but it's been well implemented. This is a high impact program. 6 of the alumni of the previous CELP programs have gone on to college. 2 were Silver Knight nominees here in Miami-Dade County, and 1 was the recipient of an Outstanding Service Award at New World. And interestingly, 2 of them developed a disability website to really provide a place for disability information and promotion as they move forward. So we are having an impact with those high school students that we had hoped when we came up with this plan to begin with. Our clinical services continue, even in the face of COVID, to be extraordinary. As you can see here, we had over 16,000 clinical contacts this last year with our program. Now, many of them were telehealth, but we got the services out there. Increasingly, or consistent with our prior experience, 85% of the services they're providing are to children and families from minority backgrounds. And so this is what we do. It's what we do incredibly well in a variety of different programs, but I'm also very excited that more than 50% of the services that we provide are provided in the community settings and not here at the Mailman Center. And that's the way that we really should be doing this work. And I commend everyone for really making this work. In the research field, we've had a very good year as well. We've had 8 new IRB approved studies. We have 42 ongoing studies, and people have been writing grants, either continuations of existing grants or new grants like crazy. And we had 76 grants go through ORA this year for submission. And it's been a pretty good year in terms of outcomes of all of that work. We have 76 funded research projects at the Mailman Center across our matrix center. We had 35 publications this year. I think the publications are a lag indicator of the grants. So I anticipate that we're going to wind up seeing a year, 2 years from now, the publications that result from all of those grants that we've had funding. It takes a little time to collect the data and publish the papers. But we've had, I think, in the last 2 or 3 weeks, 5 papers that have been accepted for publication or have come out. And so the work is really being done. And in COVID, using Zoom really works well. You don't have to travel a long way, and we've been able to do 107 different presentations at national conferences, at regional meetings, and at local in local area settings. And so what effect did COVID have? Made us maybe a little better. And we continue to be cited. Interestingly enough, the number is there. I did a little bit of digging. While the number of times our work was cited was the same as last year, the citations are coming in papers that are being published in higher impact journals. And that's one of the things that we do, because if we get cited, if we're cited in a journal that 3 people read each year, that's not high impact. If we're cited in the New England Journal, then that's high impact. And we are seeing an upward creep. We're going to have to figure out the metric of how to look not only at numbers, but at the impact of those citations. But people are reading what we're doing and including it as citations in their work. Our IPCs, I want to thank all the IPC directors. I gave you templates to send me information, and It's taken a lot of time to plow through all of that. I've tried to consolidate it for this presentation to just show the impact of what you're doing and highlight a few of the things that have been really outstanding. Our community health IPC with Dr. Natali and Dr. Shankar has been very productive and doing a lot of very important things. As you can see, this IPC, the members of this IPC submitted 7 new grants and 2 continuation grants. 6 of those were funded and 3 continuations were awarded. These were, I think, really importantly, a lot of them from federal sources, the NICHD, HRSA, U.S. Department of Education. Of course, we've had a number of grants from the Children's Trust, and they can continue to be a major partner in our community work. We've had the Robert Wood Johnson Foundation. We've had successful submissions to the University ULINK program and the Healthy Start Coalition. There have been 10 publications that have come out of the Community Health IPC, and the journals are listed there on the screen. I won't read through all of them, but some very good, appropriate journals for the work that we do. We've had 16 national publications or presentations from the IPC. And importantly, in terms of our innovation, I mentioned at the beginning, work with the Power Up for Babies group to work on collective impact at the state level for infant mental health care. We've worked with the OCYC on space-based initiatives to develop community connections with child care centers in the community. We've partnered with St. La and the IDEAS Consortium that's been put together, university and a number of organizations in the community to develop an app so that parents can find quality child care. And beginning to use the Kubi robots in child care centers, technology at age 3, a really exciting impact. Excuse me. This is a list of our members and where they are from the IPCs, and you can see we're spread out across multiple departments. I had mentioned I was going to highlight the cartoons. Since I was probably 2, I've loved cartoons. I always want to highlight Ruby's work in this area, and this has been very impactful. Now, I know some other people have tried to copy it, but we were there first. And with this slide, I don't have time to talk about all the work and the impact that our various programs in the Health Caregivers, Healthy Children, the Jumpstart program, the Early Discovery, Families First. Ilana and Connie, we need to get a logo for Families First. I couldn't get one to put on the screen, but we have some of the most impactful programs that are reaching out into the community. They're not focused on helping us do well. We're really helping child care centers, systems across the community, agencies, providers, and communities. And the impact of these programs is very, very hard to be able to put into numbers or words. I just wanted to put this slide up to say thank you to all of you who are involved in those programs for the tremendous work that you do. I'm vice chair of the Early Learning Coalition of Miami-Dade and Monroe now, and almost every board meeting that I go to, somebody mentions one of our programs as having an impact in the child care centers in the community. So I really want to say thank you. And the work that is happening not only in child care, but specifically focused on child care for children with developmental delays and developmental disabilities, we are recognized in this community as the expert, the go-to on disability in the early childhood group. The Neurodevelopmental Intervention Science is led by Michelle Berkovitz and Lynn Miskill. This also has been a very productive year for this IPC with 6 publications and 7 under review in very good journals. 8 new grants submitted, 9 continuation grants submitted. 7 have been funded and 9 continuations have been funded. Really good work there. And again, here, a lot of work in the U.S. Department of Education, Agency for Community Living, Institute for Educational Sciences, the Florida Department of Education, CDC, and some clinical trials from industry sponsors. They've had 18 presentations at national meetings, which was impressive. And in the community engagement and innovation, they've really been leading our efforts with funding that's come from the CDC and the ACL on COVID vaccine confidence in the developmental disability community, working closely with our community partners. They've worked on Florida embedded practices and intervention with caregivers trial, the Florida EPIC, which is being started up, that Dr. Berkovitz is our PI for locally, and Project Impact, improving parents as communication teachers using telehealth, and really nice work going on in that neurodevelopmental intervention science. And again, the evolution of the IPC is wonderful to see. It was at first focused on clinical service delivery. And as you can see, it is now evolving into impact in the community, conducting relevant and highly impactful research. A lot of people really like this IPC and are members of it, as you can see here from all over the department and the school. Our neurodevelopmental discovery IPC, Bob Pfeiffer and Daniel Messenger are our leads of this. This IPC has a huge task for pulling together scientists from across the community and really focusing on the kinds of things that can make an impact. They've submitted 3 grants this year, new grants. They've had 8 grants funded and 4 continuation grants. And these are where we want them to be, from the NIH, from HRSA, from Florida Department of Education, from foundations, the National Center for Special Education Research, Autism Foundation, and Microsoft and Google, moving into the technology world. They've had 15 publications in some high impact journals, 7 presentations at national meetings, and I have really been working hard on the issue of the impact of COVID-19 on children's long-term development. And I'm going to take just a minute to to highlight a couple of the initiatives, not to make them stand out, to use them as models for where we are. Here's the membership of this IPC. We started last year working on a initiative to create a core here at the University of Miami and with the Mailman Center to look at long-term effects of COVID in children, working with Dr. Ophir on a follow-up clinic. And then the NIH released what was called an OTA. It was a request, a very different mechanism with an unlimited budget. We put together a group of faculty from across the school, and actually across the university, to look at all of these different things that are in the circles around that, and very quickly, actually in 30 days, put together a proposal for about $28 million to look at long-term COVID. Unfortunately, we weren't funded. They made a decision to fund pediatric programs that had large networks across the country. So the group is now working on a new strategy of multiple R01s that will be submitted this spring to really look at long-term effects of COVID. And we have 2 R01s actively being developed and prepared for submission this spring. Just a great example of people from all over working on projects together. I'm going to share this one. I'm the PI on it. That's not why I'm sharing it. This is really one of our first ventures into basic science in neurodevelopmental disabilities. And we submitted an application last year for the Executive Dean for Research High Risk, High Reward Award, and actually we're funded. It's a cross-departmental center collaborative team that consists of me, Dr. Asha Pillai, and Dr. Ophelia Alvarez, Dr. Colleen Atkins and Jackie Sagan, and Dalton Dietrich from the Miami Project, Dr. Josh Hare from the Interdisciplinary Stem Cell Institute, and Ali Saad from pathology. And the focus of this study is using a sickle transgenic mouse. We're evaluating whether infusion with mesenchymal stem cells, or MSCs, can reduce or eliminate the incidence and severity of pain, but most importantly, memory or learning deficits in the adult mice over the course of their life, using that as a basic science model that may have translational impact into use in human models. For instance, if we are successful with this model, it gives us justification to begin using MSCs in young children with sickle cell anemia to prevent the kind of cognitive injury and central nervous system injury that occurs almost uniformly in this population. I share that because that's a model that we need to be able to continue to explore, particularly if we have a long developmental outcome question that will take 30 years to answer. We may be able to really refine that by collaborating with basic scientists across the board. I will tell you, I am not an animal researcher, but I had to learn how to give IM and IV injections to mice and go through IACUC training and the whole light. It was quite an adventure, but one that I think is well worthwhile and a model for us for the future. Our lifespan IPC, Dr. Larry Friedman and Dr. Shelley Bear have been, this IPC has done some phenomenal work. You know, when I look at the research side and, you know, 1 grant submitted, no continuations, 1 funded, no publications, looks like they're goofing off, but they're not. This has been a very high impact IPC. As I mentioned before, the progression across transitions in healthcare, our PATH clinic was a monumental effort that required collaboration with faculty from the Department of Medicine. It is one of the first model programs for primary care for adults with disability in the country. There's literally a handful that I can count that had pulled this off. This was a major undertaking. The development of the rapid response training for healthcare providers during COVID was a high impact initiative that has gone way beyond the walls of the center. And being able to get disability content embedded in the curriculum of the training for medical students was a very significant accomplishment in the training area. They have conducted 2 Ask the Experts in the community for vaccine hesitancy initiative. They've surveyed providers of speech, PT, and OT about how services have been going during COVID for individuals with intellectual and developmental disabilities, and importantly, have updated a list of dental providers who will work with adults with developmental disabilities, a real shortcoming. So I look to the research to be something that is going to take off over time, but the impact of the program of this IPC has been substantial. And these are the various members that I want to acknowledge. And our Promoting Behavioral Health IPC, Lizzie sent me, I think it was a tome of the work that they've been doing, and really appreciated that. Lizzie and Julieta Hernandez are our co-leads for this IPC. They've submitted 12 new applications for grants. They've had 10 funded and 14 continuations funded from Taft Foundation, Children's Trust, PCORI, NIDDK, Florida Department of Health, U.S. Office of Head Start, HRSA, NIMHD, ULINK, and our CTSA. So really nice work there with 45 publications. And I'm not going to begin to read the journals, but it's really quite impressive. 32 presentations across the country and the world, and have been doing a lot of work in community engagement and innovation with town halls on COVID-19 focused on return to school. And Jason Gent really led this initiative that I talked about earlier of Project SO. And I want to highlight these two projects just, here we go. I skipped all the members of this group. It's a big group. The town halls have been developed to promote accessibility and confidence in COVID-19 vaccines at the intersection of disability and lived experience, to provide consistent and accurate health information and provide community outreach and resources. This is going to be a very substantial and significant effort going forward as this pandemic just refuses to let us go. They've conducted a series of town halls that engage families with and without family members with disabilities, as well as community members, providers, and other stakeholders, and have focused on inclusion and representation of diverse voices at the time of school return. And Project SO, I mentioned that Jason has really led for us, is an ongoing thought leadership committee with the Children's Trust designed to build training for providers that intersects promoting socio-emotional wellness with principles of diversity, equity, and inclusion. Also trainings for agency executives and staff, online service navigation for providers and families, and resource mapping. This will be an incredible resource for our community when it's finished. The Family Navigator program continues to be a gem of our program. We are getting 23% of our referrals from the community, 77% internally. And you can see at the bottom the distribution of the types of disabilities that are being referred in. Importantly, we are connecting 78% of the families successfully to services where the national average is 50%. So Family Navigator program has done just incredible work. I wanted to give a nod to some of our programs that don't always get acknowledged. Our child protection team has just worked like crazy during COVID, has not missed a beat. They've provided over 2,700 services related to child abuse and neglect. They've done court testimony. They remain fully functional, took on new responsibilities. They even assisted the state attorney's office with more than 100 forensic interviews. It was not part of their regular work. And they've been training medical students, graduate students, interns, residents, fellows, and provide training for international physicians in child protection. This is a major program. They're over in the PAC. We don't really see them working alongside us very much, but I wanted to acknowledge the incredible work that our CPT does. Same for the Debbie School. You've heard me really praise the Debbie School, but during the pandemic, they have managed to keep an enrollment of 131 children. That's down from non-pandemic of 153, but they're doing it not only for children who are typically developing, but with over 100 or near 100 children who have deaf and hard of hearing challenges or varying exceptionalities. And the Debbie should be really acknowledged for that. They've remained open. They've followed CDC guidelines. They've done masks for children over 2. They work closely for parents for a safe environment. They provided support for other community childcare centers. And quite honestly, when there's a question that the Early Learning Coalition has about safety in childcare, Avelia Torres calls me and calls Kathy. So we've been really advising the community on safety standards. There's been a number of studies that have been done during COVID at the Debbie, as well as extensive training, which is what the intent was when the Debbie was built 50 years ago. Our social equity work group came up with some recommendations last year, and we're working on these. One was a DEI social equity champion, and I hope we will be able to name that individual right after the first of the year. I put in a request to a donor to fund our social equity initiative, not only for the funding for the champion, but for other initiatives. And so I'm hoping that that decision will come down very soon. Along with the champion, we'll be setting up a DEI advisory board in early January. One of the big pieces that came up over and over was compensation equity. And so for our staff salaries were, when we looked at those, were within real consistency for equity, but our faculty salaries were not. And so while we haven't been able to make any of our faculty rich and wealthy, we have been able to develop a standard scale for compensation that we can use, and we've addressed inequities across the board. And I think everyone saw those adjustments going back to August in their paycheck last month. And so that's an important first step. And unfortunately, what had happened at the university in many cases was the longer you'd been here, the more likely you were to be paid more poorly. And that's not only the Mailman, that's across the school and the health system. And so this was our step to make adjustments and get to equity. So some of you were making more already, you didn't get adjustments, and some of you were way down and you got big adjustments. But going forward, what we can say is that we're doing things in a fair and equitable way. There was a recommendation to expand translation services. We're going to be working with UHealth on that. We will be working on our DEI value statements this spring and ongoing to assess what we're doing in terms of DEI, and I think particularly equity at the Mailman Center. So a lot of work still to be done, and many thanks to our work group team that helped to pull that together and get us on a path that is really exceptional. You know, our strategic priority was the interface between disability and diversity, and these have been the principles of partnership, which you've seen before. That work continues to go really well. I just wanted to highlight a couple of things that we've been able to do this year that were new and add to the list. Certainly our vaccine confidence initiatives in Overtown with OCYC have been important. And we were able to assist OCYC in obtaining funding to improve the developmental skills of 3-year-olds, building systems of care. And that was one of our goals, not to have the money come to the Mailman Center, but come to the community to address the needs that they had identified. And we have a phenomenal partner in OCYC and Graylin Smiley Woods and her team. We're very happy with that. And we've been doing this similar kind of work with Connect Familias in East Little Havana, and anticipate being able to do some continued expansion work potentially in Alapata in the near future. We've developed a new partnership with the Northeast Corridor, specifically with St. La, and are looking forward to developing that initiative over the years. Dr. Stodant is really our key connection in that region. And I don't want to ever skip over the Jasmine Project. We do a lot of things here at the Mailman Center to improve quality of life and for children with disabilities or at risk for disabilities. The Jasmine Project is really focused on keeping them alive, and they do a really great job. Alana, I see you nodding your head. We're really appreciative of the work that is going on. That initially started with Black infants and is now expanded to Hispanic infants as well. So the breadth of the program has been really tremendous. This is a slide that we showed last year. The take home from it was that Renee Schmidt did her capstone project and looked at what was the impact of our working with these communities, what was happening at a population level. And as we've talked about in both Overtown and East Little Havana, we saw significant improvements in high school graduation rates and a number of things in terms of kindergarten readiness. And unfortunately, where we were not doing the community connectedness in Alapata during that same period of time, those declined. That paper has been written when we just got notice that it was accepted in the Maternal and Child Health Journal this last week. On our launching pad, will we continue to focus on federal grants and planning for large center grants in the future? We hope to be able to have some things going out in 23. COVID has slowed us down a little bit there, but I think we're moving in that direction. We are continuing to work on development of population-based outcome measures, those high level. Not only are we impacting the child and the family, but are we in fact impacting entire communities? We want to work on commercializing our DASH curriculum, expanding our telehealth capacity. This may actually be one of our innovative components of our next USAID grant, which is the bullet down. It has to go in March. We're working with the South Florida Behavioral Health Network on a trauma exposure VOCA grant. The funding should start to come in on that after the first of the year. And I hope that we will become a model for the initiative that we're working on at AUCD. That was the focus of the conference that we just had, which is engaging individuals with disabilities and lived experience in all aspects of research and helping researchers to understand how to accomplish that. I think we're going to be able to pull that into a collaboration with the national CTSA as well. I always conclude with these same slides. It's not because I'm lazy and don't want to change the slide, but I haven't found a point yet to get rid of them. We do innovation because doing things differently, leading rather than responding to the market and the policy change is what makes a difference. We focus on the impact because making a difference not only at the child and family level, but at the community and population levels is what's critical. And we do connections by doing things together, both with historic partners and collaborators that we've not previously considered. And that's our innovation, impact, and connections. It's part of our value statement. And it's really simple. I say this every year. Embrace innovation, strive for impact, and achieve success through connections. That's how we are able to accomplish all the things that we're doing. I will, like I said, it took me 58 minutes to get through this presentation. There's not a lot of time in our hour, but I'm happy to stay on if there are questions that folks can stay on or comments. I just want to say from the bottom of my heart, thank you to each of you for the work that you do, the enthusiasm you bring each day. You know, we could have been just destroyed by COVID. And I think what you've seen for the last hour is that that has not happened. We've gone the other direction. You are an incredible faculty and staff. Our trainees, we're glad to have you part of this great mission that we're on, and we look forward to when you leave the Mailman Center that you'll go out and do these same kinds of things around innovation, impact, and connections wherever you happen to wind up being, because that's the way that we will make the improvements. So thank you all, and happy holidays. I hope you enjoy your time with your family. Please do take some time to disconnect. After all, wellness is something that we value at the Mailman Center. So let me stop with that and see if there are if any of you want to stick around and ask a question. If not, we can wrap up. And I can only see 5 of you on my screen. Let me stop sharing. There, I can see everything. Any questions? All right, we're quiet. Go have lunch. Enjoy your holidays. Thank you all for being part of a really great mission.